Tape it and make it. Hello everyone. In this video, we will show you a taping technique for the inner ligament of the knee joint after inner ligament injuries or pain that is in the area of the inner knee. I have already prepared a piece of the Kintex Classic tape and another shorter piece which we cut into 3 compartments. For the taping technique, we need about 30 degrees of flexion in the knee joint. I peel off the base of the tape, tape it underneath the kneecap, completely without pulling, then further peel off the backing paper and with very light pulling upwards along the inner tape. Put the end on without pulling. Now rub the tape slightly. Then I remove the backing paper from the base of our fan-shaped tape and tape it on the side of the inner tape. It is important that the tape does not run into the hollow of the knee. Now I loosen the backing paper of the upper rein and tape the tape under moderate tension. The base runs out. Now loosen the second backing paper and let it run out over the kneecap under moderate tension. Now remove the backing paper of the third draw and apply it under moderate tension below the kneecap. Now apply the base without pulling. Rub the tapes again to increase the adhesive strength. And so we now have a taping technique for the inner tape with a correction pull for the inner tape area. Thank you for using Kintex. Tape it and make it.